Hi and welcome back to our page. Can your care workers apply a non-prescribed cream or ointment when they're visiting someone in their own home? This is one of the most debated questions in domiciliary care. And honestly, the amount of wrong information floating around about this is frightening. Some people will tell you that carers can only ever apply prescribed creams. Others will say it's fine as long as it's on the care plan, and some people will talk about homely remedies, which is a term that doesn't even apply properly to domiciliary care. So today, we're going to settle this properly. We're going straight to CQC's published guidance, NICE Guideline NG67, and the actual legislation. No opinions, no guesswork, just what the regulators say. So let's go. Before we get into cream specifically, you need to understand one concept that changes everything, and it's the concept that most people get wrong. There is a fundamental difference between supporting someone with a product and administering it as well. This distinction comes directly from CQC guidance and from NICE Guideline NG67 on managing medicines for adults receiving social care in the community. If a person has mental capacity and they choose to use a product, whether that's a moisturiser, a tube of E45, or an over-the-counter cream they've bought from Boots, and your carer is physically helping them apply it because they can't reach their back or they have limited mobility, that's support. The person has made the decision, they know what the product is and why they're using it. The carer is simply providing the physical assistance. If, on the other hand, the carer is making the decision about what to apply, when to apply it, and how much to use without the person having capacity to direct that, then that crosses into administration. And administration of a medicine carries a completely different set of responsibilities. This distinction matters enormously because it determines what governance you need, what records you keep, and whether a product needs to be prescribed or not. CQC has a dedicated guidance page called Over-the-Counter Medicines and Homely Remedies. And this is what it says. People should be supported to manage their own care. Giving people access to over-the-counter products and enabling them to choose is an issue of equality. You should make adjustments to support all people to access them. That's CQC explicitly saying that people receiving care should have the same rights as anyone else to use over-the-counter products. If you're not receiving a care service, nobody stops you buying E45 cream from a supermarket and putting on your dry skin. The fact that someone receives domiciliary care shouldn't take that right away from them. CQC goes on to say that you should have a policy to support people who wish to self-care or who need to manage their own care as well. This should include the necessary safeguards to support a person to get access to over-the-counter products. And critically, staff must be trained and competent to support a person to self-care with over-the-counter products. CQC also say that a healthcare professional may recommend a specific product to treat a minor condition that doesn't require ongoing treatment, which the person, their relatives, or care staff can buy. For example, athlete's foot cream, and they say you must record verbal or written instructions in the person's care plan. So, CQC isn't saying only prescribed, CQC is saying it needs to be safe, documented, and person-centered. Now, let's clear up the homely remedies confusion, because this comes up constantly and most people do get it wrong. A homely remedy is a specific term. CQC defines it as a medicine used to treat minor ailments that's purchased over the counter and kept in stock in a care home to give people access to medicines that would commonly be available in any household. The key words there are kept as stock in a care home. In domiciliary care, you're not stocking medicines. You're going into someone's home where they already have their own products. The homely remedy framework, which CQC links to NICE Guidelines SC1 on managing medicines in care homes, is designed for care homes, not for home care services. NICE Guidelines NG67 is one that covers medicine support in the community, and that's the guidance that applies to domiciliary care. So, if someone tells you to set up a homely remedies policy for your domiciliary care services, they're mixing up care home guidance with home care guidance. What you actually need is a clear policy on supporting people with the over-the-counter products in their own homes aligned with NICE NG67 and the CQC's OTC. Right, so how should you actually handle this in practice? Here's the framework we use with every single domiciliary care provider we work with at CareSync Experts. Step 1, confirm capacity before anything else. Does the person have the mental capacity to make the decision about using this product? If they do, they have the right to choose, and your role is to support that choice. If they lack capacity, you need to follow the Mental Capacity Act. Involve the appropriate people and make a best interest decision. This is not optional. CQC will want to see that you've considered capacity. Step 2, check for safety. All over-the-counter products purchased on behalf of the person or brought into a care setting should be, and I'm quoting CQC directly, checked with an appropriate healthcare professional to make sure they're suitable. This means a quick check with the pharmacist or GP. Does this cream interact with anything the person is already prescribed? Does it contain an active ingredient that could cause a reaction? For example, E45 contains lanolin, which people may be allergic to. This needs to be checked first. Step 3, document everything. CQC's guidance says any support provided by care staff to help people use over-the-counter products must be recorded. If care staff are responsible for administration, record this on a medicines administration record. NICE NG67 is clear that it applies to both prescribed and over-the-counter medicines. So, whether it goes on the MAR or in the care plan depends on whether you're administering or supporting. If the person with capacity is directing the carer and the carer is helping them apply their own moisturiser, record it in the care plan. However, if staff are administering an over-the-counter product because the person lacks capacity, treat it as medicines administration and record it on the MAR. Step 4, care plan it properly. The care plan should record what the product is, why it's being used, who authorised or recommended it, how it should be applied, how often, and what the person's wishes are. This applies to everything, from a simple moisturiser to a pharmacist recommended antifungal cream. And there's one more thing I need to flag, because almost nobody in these discussions actually mentions it, and it's genuinely a safety issue. Emollient creams carry a fire risk. CQC has issued specific guidance on this following multiple fatal incidents. The Medicines and Healthcare Products Regulatory Agency, the MHRA, issued safety alerts in 2008, 2016 and again in 2018, extending the warning to all emollients, not just those containing paraffin. When emollient cream soaks into clothing, bedding or dressings, those fabrics become significantly more flammable. Since 2010, more than 50 deaths and serious injuries have been linked to emollient use, primarily where people are smoking or near naked flames. This applies directly to domiciliary care. If your care workers are applying emollients, you need an emollient fire risk assessment in the care plan. The person should be advised not to smoke or go near naked flames. Clothing and bedding should be changed regularly, and your staff need to understand this risk. This is something CQC inspectors do look for, and it's something that protects people from real harm. So let me put all this together for you. Can care workers apply non-prescribed creams and ointments in domiciliary care? Yes, they can, but there's a right way and a wrong way to do it. For example, if the person has capacity and is choosing to use the product, your carer is supporting, not administering. Document it in the care plan, check it's safe with the pharmacist, and respect the person's right to make their own choice. If, however, the person lacks capacity, or if the product contains active medicinal ingredients, you need stronger governance. That means pharmacist or GP involvement, MAR recording, and a clear best interest process. Don't use the term homely remedies for domiciliary care, it's care home guidance. Use your over-the-counter support policy aligned with NICE NG67. And please don't forget the emollient fire risk assessment. It could save someone's life. The bottom line from CQC is this: people receiving care should have the same access to the over-the-counter products as everyone else. It's about equality, safety, and good documentation. Get those 3 things right and you're in a strong position. If you need help getting your medicines policies right, or you want support with CQC registration, compliance, or inspection readiness, get in touch with us at CareSync Experts. The link is in the description.